Hello, it's a Pharm review part 3. So continue with the CNS drugs. Migraine. For prophylactic drug will be propranolol. For acute treatment, sumatriptan. So those are the triptan and ergotamine. So those are the two classes of drug to treat migraine. Cardiovascular system. Antiarrhythmic agent with membrane stabilizing effect, beta blockers. General mechanism of antiarrhythmic. Class 1 is sodium channel, lidocaine. Class 2 beta blocker, example propranolol. Class 3 is potassium channel blocker, amiodarone. And class 4 calcium blocker, verapamil diltiazem. So the mnemonic I use is South Beach Polka. So South is for sodium, Beach is for beta blocker, Polk would be for potassium, and Ka would be for calcium. So South Beach Polka. Drug that could induce lupus-like type of effect is procainamide, isoniazid, that's for TB drug, chlorpromazine, the phenothiazine, hydralazine is the vasodilator. Amiodarone with broad spectrum. Amiodarone can display type 1, 2, 3, or 4 antiarrhythmic type of activity. Amiodarone is one of the most commonly used antiarrhythmic drug out there. And remember, the amiodarone toxicity in the eye would be wall keratopathy, so wall looking like keratopathy. Amiodarone require monitoring because it has different toxic effects on the heart, the liver, the thyroid, lung, the eyes, the wall keratopathy as just mentioned about. Thyroid is because amiodarone actually is made up of iodine too, so it does have iodine compound in it. So if a patient who allergic to iodine, amiodarone may not be a good choice. Atrial fibrillation treatment. So in this case you can use digoxin. Digoxin is a sodium potassium ATPase inhibitor. Digoxin actually have a narrow therapeutic index, and so the patient may get toxic effect, and one of the first toxic signs is actually blurred vision or changes in color perception for digoxin. And usually if a patient on digoxin, which means they can be on for atrial fibrillation, but they can also in the moderate to severe stage of heart failure, whereby they have digoxin in addition to the ACE inhibitor and beta blocker. Congestive heart failure, as you can see, cardiac output 5 liters per minute equal to heart rate times stroke volume. Compensatory response to congestive heart failure, you have fluid retention, chronic activation of sympathetic nervous system leading to the cardiac remodeling. Instead of getting an elliptical shaped heart, you have more of a spherical or round heart. So you want to use medication to increase contractility, digoxin. You can also use beta blocker like metoprolol, which is more of a beta 1. And dobutamine in this case is a beta agonist. In this case, when you have more of an acute setting of heart failure and you want to quickly start the heart, that would be dobutamine. Angina treatment, you can use nitrate, calcium channel blocker, or beta blocker. And remember, nitrate are contraindicated in patients who is taking like Viagra, Cialis, those are sildenafil, vardenafil, and tadalafil. Tadalafil is a Cialis, is the longest acting type of erectile dysfunction drug. Calcium channel blocker, you have verapamil, diltiazem, nifedipine, which decrease the contraction of the heart and increase vasodilation. So it's good for lowering the demand of the heart, so helping with the anginal type of symptom. Medication for congestive heart failure, there are different classes as you see there: diuretic, vasodilator, ACE inhibitor, angiotensin receptor blocker, phosphodiesterase inhibitor. For the ACE inhibitor, remember it actually can cause persistent dry cough because due to the increased level of bradykinin, and it can cause also angioedema. Angioedema is swelling of the deep layer of the tissue. So sometimes angiotensin receptor blocker are used as substitute to ACE inhibitor to avoid those persistent cough, angioedema. This is the hypertension Joint National Committee come up with 7 in terms of a recommendation of a level of blood pressure, systolic on top and diastolic pressure on the bottom. So you have normal is less than 120/80. Then there's a category of pre-hypertension, so 120 to 139 and 80 to 89. And then you have a hypertension 1, hypertension 2. Usually when a patient on hypertension 1 is most likely they need to be on medication. If they're in the pre-hypertension, diet and lifestyle modification like taking less salt may help, but when they get to stage 1, most likely they need to be on medication. Over blood pressure with diabetes or chronic kidney disease is actually a little bit lower because you have comorbidity there. Blood pressure equal to cardiac output versus total peripheral resistance. So peptidase released by kidney is the renin. So renin is in the renin-angiotensin system. So renin will activate conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is the one that causes vasoconstriction. Most commonly used thiazide diuretic would be hydrochlorothiazide. Thiazide diuretic, as you can see, HCTZ and chlorothiazide. They work on distal convoluted tubule. Cross allergy with the sulfonamide because thiazide are also sulfur drugs. Loop diuretic, furosemide, and working on ascending loop, and it work on the sodium potassium chloride co-transporter. So loop diuretic is the most potent class of diuretic compared to thiazide, even though thiazide is the most commonly used for high blood pressure. And loop diuretic tend to be used for like congestive heart failure where you get peripheral edema, so you need to have a little bit more potency to get rid of the fluids from the body. Side effects of diuretic tend to cause hypokalemia. So that's why you have a class of diuretic is potassium sparing. So those thiazide diuretic, loop diuretic often are used with the potassium sparing diuretic to try to keep some of the potassium in the system. Hypoosmotic or osmotic diuretic, acetylzolamide and mannitol. So this is a class of drug. Acetylzolamide is Diamox, right? As eye care provider, you do use oral acetylzolamide or Diamox to help to lower the fluid in the body, lower the, for instance, intracranial pressure, or lower the pressure from the eye in acute angle closure. Metabolic disturbance of carbonic anhydrase inhibitor, it can lead to metabolic acidosis. CAI used also for altitude sickness. So if you want to climb a high mountain, you need to take oral Diamox maybe a week or 2 before the climb, and that it helps to reduce the pressure in the brain. Potassium sparing diuretic, as I mentioned, is spironolactone. Spironolactone is an aldosterone antagonist, and then you have the triamterene and amiloride. Those are more of sodium channel type of blocker that work in the distal convoluted tubule. Beta-1 agonist, you have betaxolol, beta-1, using in terms of eye drop, metoprolol, and atenolol. So these are more of the beta-1, so specifically for the heart and less effect on the lungs, so it's good for patients with asthma or respiratory problem. Non-specific one, you have propranolol, timolol, nadolol. Alpha and beta antagonist, carvedilol, which can be used in congestive heart failure. Labetalol is also block alpha 1 and beta blocker. ACE inhibitor, Obril, so those are the suffix. Side effect, I already mentioned, is hypertension, dry cough, angioedema, swelling of the deep layer of the tissue. Angiotensin receptor blocker, Sartan, so that's the suffix. So can use as substitute if patient cannot tolerate ACE inhibitor. Contraindication for both ACE inhibitor and angiotensin receptor blocker is that they are teratogenic, so avoid pregnancy. Alpha-1 antagonist, Osin, so those are benign hyperplastic, benign prostatic hyperplasia, so BPH tend to use Osin, and I talk about iris floppy iris syndrome. Alpha-1 antagonist side effect is reflex tachycardia and syncope. So usually when the patient starting with prazosin or terazosin, is that they tend to get syncope because it can drop in the blood pressure. And then what happens is you have reflex tachycardia. Alpha-1 antagonist is used for benign prostatic hyperplasia and hypertension. Alpha-2 agonist, I mentioned already, presynaptically, it kind of acts in a sense to inhibit release of neurotransmitter. Postsynaptically, it may act just like an agonist. Clonidine use can use in nicotine, heroin, alcohol withdrawal, so those addiction treatment, migraine prophylaxis, and severe pain, so quite a few use for clonidine. Vasodilator, you have hydralazine minoxidil, and also if you're aware, minoxidil can also be used for male pattern baldness, right?